Good
Um,
morning, everyone. Today we welcome our guest speakers from MDHHS Division of Environmental Health. We have Ashley Mark, who's the Regional Community Engagement Coordinator for Region 1, which is our area kind of, and in Southeast Michigan here. We also have Dorian Ballard, who will be co-presenting with Ashley, who is a contractor with MDHHS. Is that correct, I think? Yeah. Okay, they're going to talk to us this morning about environmental health programming with MDHHS and the Division of Environmental Health, and what your library can do to host environmental programming throughout the year with the Division of Environmental Health from MDHHS. So I'm going to turn it over to them, and they're going to share everything they have to offer.
Perfect.
Thanks for
Thank
being
you
here.
so much, Steve. We're excited to be here. We love to connect with libraries. They're such an important resource in their communities and a great hub of information and a way to get information out to the community. So really happy to be here. And as Steve said, I'm here with Dorian, and she's going to take us away and tell us a little bit about the Division of Environmental Health.
Sorry, guys. We're in Zoom, not Teams. So I'm clicking around trying to find where Teams are. But just like a little clarification on my role. So me and Ashley have the same position. I am the Region 2S Community Engagement Coordinator. So I cover Wayne, Washtenaw, and Monroe County. So I would reach out to libraries in that area and kind of do this presentation or give out some information about the programs that we have. So just a little bit about MDHHS, our mission, our vision, and then we get down to DEH goals. We want to make sure that people have a safe place to live, work, and play, and that their environment is conducive to them living a healthy life. It's really important that we focus on the data that we have for this, that we're a data-driven unit. We use data to guide our decision making. We use data to guide, our equity practices, and that really the three things we focus on are preventing injury from environmental, chemical, and physical hazards. We'll go to the next one. So the division is pretty big. We are the largest division within MDHHS. We, as you can see, have a ton of units. We are supported by, we're supported by toxicologists, epidemiologists, health educators, all these various sections, and we all work together. So we're here in the community education and outreach unit, but we work really closely with our lead services, for example, to get information about their program out, or our field epidemiologists to really understand what's going on from a data perspective in communities. One of the biggest folks that we work with is our chemical planning and response. They are responsible for our lead filter distributions. So for example, I just went to an event yesterday where we had community engagement, outreach, chemical planning and response, and lead services all at the same event, giving out information and physical resources. So giving out, giving out filters, giving out, part of organizations give out washing materials. So we all work together. So the division utilizes what we call the 3 I's: identify, investigate, and intervene. These methods we use these methods to really identify exposures, then investigate the related health effects of those exposures, and then we intervene with public health actions. New areas of concerns, just new areas of concerns or gaps in resources and education are really, they're constantly coming in, constantly being identified. We're out talking to organizations in the community, and we work with organizations to fill those gaps in awareness and education. So these are kind of the things we develop our programs around. So we've got air, food, soil, community, home, and drinking water. So here's a map of how we kind of organize our community engagement structure. So as you see, Ashley is Region 1, which is down in the kind of middle of Michigan. I'm Region 2 South, which is right up here, Washtenaw and Monroe County. And then we have the rest of the state broken down into regions. They follow the emergency, the health coalition region, so kind of broken down by population. And so we've got someone to cover every part of the state. So wherever you are, we've got someone who can provide you resources and get you connected with the state for things you may need. All right, so now just a little bit about what we do. So as the liaison, basically, between MDHHS, environmental health, and organizations, one thing we do is we work with organizations who already have local efforts going on. The last thing that we want to do is come into communities, addressing populations, and implement new things. We know that there are people in these communities already doing work. We know that there are issues that have already been identified by folks. And so we come in a support role and really a capacity building role. The next one is engaging communities on the programming that we have. So a lot of the programming that we have, the local health departments also have that programming. And we're going to get into that in the later part of the section. But we have some state program that is funded, state programs that are funded that kind of cover between nutrition, lead services, a bunch of stuff. We do offer opportunities for feedback. That's one thing that folks said they wish they had, is just the ability to connect with someone and have their ideas kind of ingrained into programs about how things could work better for their communities, what's a better way to disseminate information, do outreach, and improve our programs. We keep communities updated. So we have a monthly email that we send out with DEH resources that we get from our programmatic teams. And we have, what's what I'm looking for? They have like materials, education materials, and more information about how to connect with different departments in MDHHS and your local health department. And then lastly is communicating during local emergencies. When things happen, like a community becomes an action level exceedance for lead or anything like that, we really rely on our community network to get that information out to folks and really be that trusted source in the community where people can go and receive resources.
Perfect. Thank you so much, Dorian. And now I'm going to go into a little bit more in depth about some of the different programs that we have within the division. So it's going to be a crash course, a lot of information. I'll try to keep it pretty high level. And then if anyone has, people here or the people watching after this, if you have questions or want to learn more about any of these particular programs, you can feel free to reach out to me, Dorian, or Lauren, and we'd be happy to share more info with you. But wanted to start with our lead program. So this is one of the larger programs that we have within the division. That kind of has three different components built under this umbrella of our lead program. So we're really trying to move towards a proactive approach to responding to lead in communities. So we've developed what's called the Childhood Lead Prevention Communities Program, or CLPC program. And it's really an effort to identify like vulnerable communities across the state, and then to step into those communities and provide resources and opportunities before lead becomes a significant hazard to the residents. So one piece of that is responding to lead in drinking water, which I think is automatically where people's minds go when they think about lead. So when a community has what is called an action level exceedance, so their public water supply has high levels of lead in the water that requires some response, that's when DEH, or the Division of Environmental Health, will step in and provide things like filter options. We'll go, door to door if we have to distribute filters. We provide health education materials. We'll help sample water to ensure that people's levels are safe, things like that. Another piece of what we do is moving away from drinking water and looking at a person's full home. So our Lead Safe Home program offers an in-home lead investigation to qualifying families, where we'll come in, take a look around, and identify any potential lead hazards in the home. So things like lead paint, lead plumbing, lead dust, soil that might contain lead outside of the home, things like that. And if any of those things are identified in the home, we'll provide lead abatement services. So we'll remove the hazards to make the home what is called lead safe. And there's funding opportunities it's a free program for qualifying families. And then if you don't qualify necessarily based on like income level and other qualification requirements, then there are like other low interest loan opportunities for other families. And then the third piece of our lead program is our childhood lead poisoning prevention program, which is an effort to encourage blood lead testing for kids. So we really want people having their kids' blood lead tested. And then if a child does have a high blood lead level, we offer resources and in-home nurse case management program to help families deal with that very difficult time. So that was a crash course in our lead program. And I did include a few images of some of the materials we have available. So any of these are available to print it out and mailed to your library to have on hand, or put out if you have like a resource table or anything like that. So we have some specific to pregnant and breastfeeding persons. We have a fact sheet on lead poisoning, cleaning your faucet aerators, lead in drinking water. Well-fed means less lead. And then we have our little postcard that sends people to that application for that Lead Safe Home program. So that is just a smattering of the many, many, many lead materials we have available. If you're interested in any of those, let me know and I'd be happy to connect you with. We have a website where you can go on and order any of the different materials. We even have like posters and all sorts of cool stuff. Moving on to our PFAS response. So PFAS contamination has become kind of a hot topic across the state, across the country. If you don't know, that is PFAS are these human-made chemicals that are found in a lot of consumer goods, things that repel oil or stains or grease or water. So anything with like a waterproof, slick, shiny surface may contain this contaminant. So yeah, it's found in a lot of consumer products. And then when folks dispose of those products, they end up in the landfills, and it's an opportunity for those contaminants to leach into our groundwater. So PFAS contamination is primarily a concern from groundwater and people who use a private well as a source of their drinking water. So we are in the division part of the Michigan PFAS Action Response Team. So we do respond to potential contamination sites and identifying new sites. We help with water sampling and health ed distribution and filter distribution and things like that. But this is another topic that we do have resources on. So if you think in your community this is a concern, a topic of interest, we'd be happy to talk with you about maybe providing some fact sheets or even presentations on this topic. I did also put in here that we have a few surveillance projects related to PFAS going on. Our PFOAMS program is one to test the PFAS levels in blood of firefighters. So I just included that because it might be going on in a community in which you live. And then we also have our MyChem program, which is kind of bopping around to different spots across the state to do a fairly inclusive surveillance of different contaminants that might exist in the blood and urine of residents to kind of figure out like what the state looks like overall. Where are there maybe hot spots of different contaminants? And then we can kind of prioritize our resources to address those. We also have our Eat Safe Fish program. So this is a really awesome program that is designed to help educate residents about how to choose, clean, and cook fish in a way that reduces exposure to certain contaminants. So things like mercury, PCBs, dioxin, PFAS, and pesticides. And we have developed regional guides that are both species and water body specific. So it'll say, like, if you go catch a trout from Lake Michigan, I don't know, and you want to know how much of that fish is safe to consume, we'll have like actual very detailed consumption guidelines for both adults and children. That'll tell you how many servings is safe based on contaminants that have been measured in the fish. So we do have that resource for anglers, people who are fishing and going to consume the fish that they're catching. But we also have a few resources, one for like eating safe fish for you and your family, and then a brochure for our Buy Safe Fish program, which specifically provides mercury related guidelines for store-bought fish. So all really good resources. And again, we'd be happy to, if you live in an area where there's like a lot of fishing, a lot of lakes or anything like that, then we'd be happy to help provide those actual regional guides to have on hand. We also have a drinking water program. So this is another one of our larger programs. The overarching goal of it is to educate residents of the state about where their water comes from. So knowing if your water comes from a private well or a public water supply, and then what that means for the quality of your water and for your health. And we also want to encourage some drinking water best practices. So a large component of this is our Care for My Well program, which focuses in on private well owners and educating about proper well maintenance and testing recommendations, and things that are important for private well owners as the owner of their own water system, in a sense. So we have a toolkit online that has all of our different materials for well owners and for just general drinking water topics. There's activity sheets, we have postcards, we have all of our social media content, fact sheets, videos, all sorts of good stuff in that toolkit. And we continue to develop new materials, and those are being added regularly. We also have a youth program for drinking water. So this is I've gotten a lot of excitement from libraries about this program, so hopefully you're excited too. But we're putting together these little activity bags for kids that focus in on like the topic of drinking water and health. So we've developed activity books for 2 different grade levels, K-2 and 3-5. We have a video, we have a children's book called Why Water's Worth It. We also have stickers, bookmarks, and we've developed like a bracelet making activity, and all that fun stuff is going to be put into these bags that we will be distributing across the state. So those will be available to libraries, to schools, to Great Starts, whoever's interested. So if you have interest in those, feel free to reach out to me, and I can put you on our list for those. I'm really excited that that's going to be happening. And we also have outreach opportunities for drinking water. For all of these programs, we're happy to provide presentations on these topics. But this one in particular, we do have like youth-focused outreach. So we have what is called an Enviroscape model. It's a tabletop groundwater model that demonstrates, it's like a fun interactive activity that demonstrates like how contamination on the surface of land can affect our drinking water sources. And the kids love it. They get to play with all the fun little toys on the board. But that's something, if you have even like Earth Day programming or anything like that going on at your library, drinking water weeks coming up soon, anything like that, let us know, and we're happy to provide a little interactive demo for the kids. We also have a harmful algal blooms program. So this is generally trying to identify new harmful algal blooms. We do data collection, risk assessment, and communication. And they are trying to revamp this program to develop some new health education materials coming soon. So if this is a concern where you live, hopefully in the next few months, we'll have some new resources to share on this topic. But right now we do have like frequently asked questions on the website and some other materials that might be of interest. 2 more programs. One is the Michigan Climate and Health Adaptation Program. So this is really a an effort to share information about how Michigan's changing climate can affect Michiganders' health. So they put out some really cool materials over the past few months. They're working on putting together like spring, winter, summer resource packets or toolkits that will have all the materials related to like that season. So for winter, it had like extreme cold and carbon monoxide poisoning information. For the summer, it's going to have like extreme heat and ticks, and I don't know, they keep developing really cool material. So this is something, again, if you want to stay updated, let us know, connect with me or Dorian or Lauren, and we can put you on our email list where we provide updates every month about the new materials that have been developed. But you can find a lot of their resources on the website, which is listed here. And then our last program is our My Tracking program. So this is an online data portal for environmental health data that is specific to the state of Michigan. It's really user-friendly. It provides some really cool, interesting data about different environmental health topics. And you can like download and print and save and share all of the materials and information on there. So another great tool, and we do have brochures that you can, order for your library that will help people navigate this resource. And that is all of our programs. Thanks for bearing with me. I know it's a lot of information, but again, if you do have questions or want to learn more about the specifics of any of the programs or opportunities for resources or presentations or anything like that, we're here for you, and feel free to reach out anytime. We're happy to connect. Dorian, do you have anything you wanted to add? Anything I missed?
No, just
Okay.
that I think it's important to say that just reiterate, I guess, that a lot of our programming can also be found at the local level. So if you all or anyone would need to be connected to your local health department, we're really engaged with them as well.
Yep, absolutely. Thank you for that, Dorian.
All right. So thank you both for this great presentation. I know we have some time for some questions. If anyone wants to, they can always hop off mute and ask a question, or if they just want to throw it in the chat, I got the chat open here. I'm more than happy to read any questions that we'd like to get answered. I'll probably start with one though, just so we can get it rolling. What do you think is one of the most popular programs that you're currently working on, just in general? Do you think it might be, talking about fish safety, or is it lead, or what do you think is in maybe the last year or so? What's the most popular one that people have been talking about?
I can give my input, and then Dorian, if you want to, you can. I think I do see kind of like a seasonal pattern for interest in our programs. I'd say around this time of year, our private well program is maybe something we're promoting a little bit more, just because it's becoming nice outside. It's a good time for people to go out and do those maintenance behaviors, activities, go make sure their well isn't, there's not flooding going on that can impact the quality of water. I would say also the Eat Safe Fish program. Again, spring's coming, people are getting ready to go out fishing. It's a perfect time for them to kind of brush up on those resources and figure out like, okay, here's where I should be fishing, where I shouldn't be fishing, what fish I should be consuming, things like that. I like to think all of our programs are important year round, but those would be the two that I think maybe around this time of year are, especially with Earth Day and things like that, are becoming more popular. Dorian, you have anything you wanted to add?
Yeah, it depends on geography. So for example, there's not a lot of folks who have wells in 2S, but there are a lot of folks in Ashley's region and in other regions that do have wells. So really like identifying the geography that you're in and what programs pertain to you. This is how we're, like I said, in contact with the local health departments pretty regularly, because I have a pretty good grasp on what's going on a regional level. I'll just add that our lead program, it's always guiding our work, with, you know, priorities from MDHHS and the legislature and things like that. We have a lot of energy and effort going into making sure that people are safe from lead and that people have the necessary resources to protect themselves if they are in a home that's has lead paint, or their water has lead in it. Yeah, I think geography and I think geography first of all, and then lead work really guides where a lot of our outreach and engagement happens.
Perfect, perfect. So while people are getting warmed up for questions, what do you think is really important as far as like just steps for people to know to identify lead in their homes, you know, whether it be paint or water? What do you think are some of those really basic steps to start with?
Yeah, I'll start. So I will say in a previous time, I worked for the Detroit Health Department as a lead prevention team manager. And this is what we did. Like we went door to door, knocking on people's doors, letting them know things. I think if you want to identify lead yourself, there's a couple ways you can do it. They have test strips that you can put on your wall. They leave a little pink dot, and if that dot turns red or changes color, that's indication that there's paint on that wall. There's also visual cues that you can use when looking at paint. So if it's cracked in kind of an alligator pattern, you know how alligators' backs kind of look, that's an indication that it's also lead paint. I think when you're looking at your drinking water, oh, my screen just got really dark. When you're looking at your drinking water, it's really important to know whether or not you have a lead service line, and I guess kind of your water source, because the state has lots of information about if there are any contaminants in any water source, if there are like anything outside of, anything like copper, anything in your water source, the state has really good information that's publicly available. And then lastly, I will say that we have a tox line, so that if you have any questions about a specific residence or community or anything like that, you can call this tox line and they'll get you all the information that you're requesting or that you need. Yeah, like I know lead is, you know, concerns a bunch of folks, as it should, as it is not good for the body. But there are ways that you can make sure that one, you can identify it, and then two, that you're protecting yourself against it. So making sure that you're eating, you know, leafy greens, getting your kids to have those blood lead level checked, which I think is really cool that our unit partners with the lead services team. So I was just at an event in Hamtramck where we were doing filter distribution, blood lead level testing, and giving out education at elementary school. So I know if there's a library, anyone who's interested in setting those things up, those are definitely resources that we have. Yeah.
Yeah, I think you covered pretty much it all, but I'll add that if you are concerned about lead in your home, if you have an older home, or if you're concerned about lead in drinking water, whatever your concerns are, our website has a lot of good information for folks. And it's pretty easy to navigate and walks you through the different possible exposure routes. So it's michigan.gov/myleadsafe, MI-lead-safe. And I think that's probably on one of my lead slide, that URL, but that has a lot of good information for folks. It's a good kind of starting place to start to assess any risk. And then one other thing I wanted to add, Dorian was mentioning how there is a way to know what's in your drinking water. We have access to that information. I just wanted to reiterate that there is something called a consumer confidence report or a water quality report That's one of the goals of our drinking water program, is to make sure people know that that information is available to them. So your public water supply, if you have water from a municipal source, they are required to provide you the information. It's kind of like a nutrition label for your drinking water. And that's publicly available to you every year. So we want to make sure people know that that's available and that they can contact their local, their water provider to access that information if they haven't, received it in email or through the mail or whatever. So that's just another good resource. And then if you have a private well, of course, the best option is to have your water tested. We recommend for lead every 3 to 5 years.
Perfect. Thank you for that. And I saw Steve just dropped some links in the chat too, with those sites as well. So thank you, Steve. Kind of spinning off into another direction too. One of the things that you're talking about was also how Michiganders are, being affected by a changing climate. What would you say are some things that Michigan is looking at, and how can we as libraries help to educate people to prepare themselves?
I'll start. I'm not an expert in our climate change program, so I would, of course, if people have like specific question, I'd be happy to connect them with the program lead for specific answers. But I can say that if you're interested in sharing information through your library on the topic of climate change and the impacts on health, we do have a pretty great fact sheet that has like a rundown of where we're seeing climate change related effects on health in the state. It has like basic statistics, basic kind of recommendations for folks. So that is a really good resource. I didn't include it in here, but that's something we do have available. If you want print copies or just a URL or anything like that, we can provide that. They also right now recently released a lot of resources on flooding. So that is kind of a hot topic for the climate program right now that they've been pressing, I think with spring coming. So there's information about like the impacts of flooding on all sorts of aspects of how your home is functioning and things like carbon monoxide, electricity, all of that, how power outages can affect things like that. So lots of good materials on flooding. I know in the winter, the biggest focus I think was on like their extreme cold fact sheet. So educating people about like how to identify signs or, recognize signs of hypothermia and exposure to that extreme cold. And then there's a similar resource for extreme heat and making sure that people recognize signs of like heat exhaustion and things like that. So those are the materials I'm aware of, but again, I'm not the expert in that program. So if anyone ever has specific questions, then I would refer them to our program lead. Dorian, did you have anything to add?
Perfect. Thank you. Still, if anybody has any questions, feel free if you want to jump off mute or if you want to drop it in the chat. I'm keeping an eye on that as well.
Do I remember correctly too, you'll do both virtual or on-site presentations?
Yeah, absolutely. Yeah, that's the great thing about having our regional staff is that we were able to kind of go where we need to and can provide those presentations. And we're really, again, here for you. We're here to educate the community and kind of, answer questions about or provide information on like the priority concerns of that community. So if you feel that PFAS is a concern in your community, we can do that. We can do cover whatever topic is of most importance to the community that you're working in. So lots of opportunities and flexibility with that.
Great. And I think for both of you, we have libraries in both of your regions. But we're happy.
Yeah, I think when we talked, I have Livingston County. I think they were included in your network.
Yes,
and
Wayne for Dorian's group.
Yep.
In Oakland County.
Yep.
Great. Well, we thank you for presenting today. We will have the recording available for libraries to take a look at, and hopefully you'll get lots of contacts for distribution materials or programming at the libraries in your regions.
Yeah, that's great. Thank you so much for having us, allowing us to share information. I'll just reiterate that feel free to reach out to us anytime. We're again here for you. We can mail you whatever materials you want, and are happy to talk about any of those different topics and answer any questions you have. So don't hesitate to reach out. But thank you both, DJ and Steve, again for having us.
No
Thank-
problem.
Thanks for coming.
Thank you.
Thanks, guys.